Hello you all, my name is Mia and I'm an OTA student and my project was on Pandas and Pan. Pandas, which is an acronym for Pediatric Autoimmune Neuropsychiatric Disorder associated with streptococcal infections. It is an autoimmune condition initially triggered by strep infections, which disrupts a child's neurological activity. Pandas occur when the immune system produces antibodies intended to fight an infection and instead mistakenly attacks the healthy tissues of the child's brain, resulting in inflammation of the brain, specifically the basal ganglia area, and including an onset of movement disorders, neuropsychiatric symptoms, and neurological behaviors. PANS is also an acronym standing for Pediatric Acute Onset Neuropsychiatric Syndrome. When an infection is trigger environmental factors and other possible misdirected immune responses results in the inflammation of the child's brain. The etiology of PANS and PANDAS is still undergoing research. A theory is that it is due to the faulty immune response to streptococcal infections. There are multiple possible causes of PANS. Around 80% of cases are thought to result from abnormal autoimmune or inflammatory response in a brain falling injury. Infections that may trigger symptoms of PANS include upper respiratory infections, influenza, chickenpox, mycoplasma, and Lyme disease. The true prevalence of PANS and PANDAS is unknown. An estimate of 1 in 200 children in the U.S. may have PANDAS, and this also goes into the fact that PANS and PANDAS are misdiagnosed into different categories. The barriers with the client factors include decrease in attention, and this is for children with PANS and PANDAS. They often have ADHD. Impaired touch, taste, and sound. Children experience sensory sensitivity. Simple touch can feel like it's hurting. They may have sensitivity to different textures and temperatures of foods. Decreased energy and drive. Children usually experience exasperations and fatigue with PANS and PANDAS. Impaired involuntary movement reactions. Children's symptoms usually include tics and decreased sleep. Children often experience difficulty sleeping with PANS and PANDAS. Along with the barriers also include performance, motors, and processing skills. These all include decreased grips, flows, and manipulates. A common symptoms includes deterioration of the handwriting. Increased organizes. A symptom of PANS and PANDAS is OCD. Decreased express emotions. Children experience the inability to properly express their emotions. They may be highly agitated. They might be experiencing irritation and not be able to have the appropriate response to a certain action. Decreased turns towards. Children can have problems with paying attention and maintaining eye contact, and this also falls along with ADHD. Decrease accommodates. They can have symptoms of irritability and aggression. There are a few fun facts about PANS and PANDAS, and I call them fun facts because it's not things that you would think would be associated with it. And it was also a nice thing to learn about. Children with PANS and PANDAS experience hand deterioration and math skills. I found that odd for having hand deterioration coming from a streptococcal infection. Many PANS and PANDAS clients are misdiagnosed with ADHD, OCD, or tics disorders. The average onset age of PANS are between 4 and 7 years and are more common in boys. Children with PANS experience exasperation and is virtually impacts every area of daily living, self-care, school-related skills, physical function, and social well-being. Children also experience tactile and sensory defensiveness. Medical management will include antibiotics that are given for strep. Also SSRI medications to help with OCD. OT self-management includes self-management such as yoga or calming music to manage stress and frustrations exhibited by exasperations and fatigue. There are a few frame of reference that will fit for PANS and PANDAS. One of them would include the rehab frame of reference. The use of assistive technology can be useful in a classroom setting to tics or handwriting decline affecting function. Assistive technologies include built-up pens and pencils to help with handwriting deterioration. Portable classroom word processors such as the Alpha Smart Banner. Graph paper, vertical lines to improve spacing in writing and to line numbers for math. Smart pens to provide an audio recording of classroom information to accompany written work. And for fatigue, you need to modify activities to accommodate for the deficits during exasperations and do strengthening exercises during remission. Another frame of reference will include sensory integration. The interventions are used different techniques to address sensory and perceptual problems. Practice of proprioception, deep pressure, and neutral warmth as weighted vests and weighted blankets. Also provide tactile input such as finger painting, different temperatures, different textures, and vibrations. And if sensory is defensive, avoid light touch. There's 3 articles that are included in my intervention. Occupation and activity-based interventions to improve performance of instrumental activities of daily living and rest and sleep for children and youth ages 5 to 21, a systematic review. The purpose of the study was to determine how effective occupation and activity-based interventions for children can improve ADLs and sleep outcomes. The data collected were peer-reviewed level 1, 2, and 3 literature from 2000 to 2017. Significant evidence was found to address interruptions in sleep. One study measured the effectiveness of face-to-face therapy. The participants received sleep education, sleep hygiene, and relaxation activities, which all improved in sleep outcomes. The level 2 study was an aquatic activity program and found significant decreases in sleep onset latency. And lastly, a behavioral sleep program was conducted and was found to significantly improve sleep routines. These findings acknowledge the need for OT practitioners to address rest and sleep occupations, which will contribute to the improvement of health and well-being. The next article is called Impact of PANS and PANDAS, Exasperations on Occupational Performance, a mixed study. The purpose of the study is to identify with areas of occupations, body functions, and performance skills during exasperations. The study was based on a survey of 111 children with PANS. The research survey centered around 3 questions. Types of limitations in occupational performance during exasperations, severity of limitations in occupational performance during exasperation, and comments from parents. The findings for the first question revealed that there were limitations in almost every aspect of occupational performance. The second question revealed several previously unreported limitations in occupational performance for the majority of the participants, such as personal hygiene and grooming, bathing, and participation in all aspects of leisure activities. Lastly, the third question found underlying impairments in client factors, performance skills, and school performance. Children with PANS experience exacerbations within almost every aspect of occupational performance. Effectiveness of therapy interventions have yet to been explored to date, yet families and OT should focus on accommodations and adaptations during exacerbations to maximize the performance of occupation. The last article is about the effects of sensorimotor based intervention versus therapeutic practice on improving handwriting performance in children 6 to 11 years old. The interventions that were looked at in this study include sensorimotor and therapeutic practice. The study was done to look at the effectiveness of the two interventions on handwriting of selected sensorimotor components in elementary age children. The data collected was based on 38 children from the ages of 6 to 11 of age who displayed deficiencies in handwriting. The study was done over a course of 5 weeks with sessions 4 times per week. The sensorimotor intervention was studied in 4 components: visual perception, motor reduced, visual motor integration, proprioception, and in hand manipulation. Findings showed there were only some improvements in 2 components, but the handwriting performance drastically declined, and the therapeutic practice was more effective and had a modest impact on children's handwriting, give and take the short period of the intervention. And that would include my presentation for PANS and Pandas. If you have any questions or concerns, please do not hesitate to ask questions in the reply sections. Thank you, and you all have a good day.